last but not least, to make sure that the hip joint is aligned, we'll bend up the person's foot or the knee. Hand will go on the ischial tuberosity once again, and right in the hip joint. And if you can't find the hip joint, once the knee is bent, you can bring the knee right over. It opens up the bottom of the hip joint. You can then take the leg and hold. Now this is going to be very, very tender. This joint probably has more nerve endings than almost any other joint in the body, because other than the shoulder joint, it has quite a bit of complexity. And you're just going to hold that. And allow the release to take place. So now we've gotten a nice balance in the hip joint, and the pelvis on the right side should be laying flat. For the video purposes only, I'm going to stay on the right leg. We'll do the left side at another time. It really doesn't matter. A lot of times I will stay on one side depending on the person. Our next goal there is if the pelvis was actually shifted this way, okay, the femur came down on a different angle. Well, because the knee joint can't compensate for all those angles, the ankle does. And how the ankle does, without causing a lot of discomfort, is it shifts the calcaneal bone. So what you're going to do is you're just going to hold. I try to get up underneath the knee and I hold right on the upper edge, the superior edge of the calcaneal bone, and I create a slight downward traction and hold. And I do this for two reasons. One is if it's the gastroc part of the Achilles that's holding the calcaneal bone out, my leg will go into extension. If it's the soleus end of the Achilles tendon, my knee will go into a flexion position. So when I'm holding onto this, as you can see, I'm pulling down with my right hand, or pulling away from the body, and my left hand is supporting the lower leg, but you can actually start to see the flexion of the knee, so it's the soleus end of the Achilles. So now we're doing it. Now it's gotten through its flexion. Now it's going to balance the gastroc for you. We'll bend the knee. We'll put the foot on the table. Okay. And can you see the foot okay?
It's hidden behind the leg.
There you go. This one all the way back. How's that?
There you go.
You'll notice that this part of the arch, the foot is rolling towards the outside. Okay, it's rolling laterally, so the foot is inverting. What we're going to want to do is we're going to want to create a nice balanced foot so that we can line up the tibia then. So we're going to get on, and I'm going to find the talus bone. I'm right on the talus, and what we're going to do is we're going to hold the talus into a position. And now remember, the talus will determine center line of gravity. Feel your foot flat on the table. So what we've done is we've taken the calcaneal bone, it's shifted more medial, which rolled the foot out. The talus bone had to compensate for that because that's going to be your center line of gravity. So those ligaments are going to position the talus bone or the skeleton into a proper position so that the tibia maintains 80% of the weight and the fibula maintains 20% of the weight. While we're here, I also notice that she has a slight bunion on her right toe. So what we're going to do is we're going to get to the sesamoid bones, because there's no movement. I can get this to do that, but it's not pulling through. See, once we get to this point here, that big toe stops. The big toe should actually come all the way back. So what we're going to do is we're going to reset the sesamoid bones. Now this pinches a little, and we're going to pull that. We're going to pull that bone and move it. There you go. And we're going to take the one on the side of the foot. There's two sesamoid bones that we talked about, and what that does is it allows the long head, the long tendon off the first metatarsal, to allow this to take place then. You know how that nice and loose now?
Yes, that's great.
Okay. Once again, we'll rebalance to make sure there. Now what you notice is, what Stephanie notices, that her hip doesn't want to, the leg doesn't want to just fall out. It actually has some stability.